name is Matthew Hopkins. This is a video competency test for surgical clinical skills on how to glove sterile nitrile exam gloves. Obviously, this is open because I have practiced with them and I only have the one. I, of course, before would perform the sanitation needed, meaning I would have washed my hands, removed rings and all that, washed my hands to make sure that there was no flora or microorganisms when I put my gloves in the hand. Also remove the rings to make sure that there was no microorganisms caught in the ring or something, and that there was no risk to tearing the gloves and causing any damage. So let's start. First thing, pull this open, split this aside, the nitrile gloves, open this up. You only want to touch the outside edges. You only touch the 1-inch border. So fold it down, pull this apart, only touching the edges. You touch the inside of the cuff because the inside of the cuff is not going to be exposed to the patient. It's going to be onto you, and your hands are sterile. So you touch right here. And just stick your hand in there. Again, these gloves are way too small for me, so if they rip, it's because they are 2 sizes too small. So that's as far as I'm going to be able to get these. They won't go over my knuckles. So same thing with this. You can touch this because the glove is sterile to sterile. Same thing. This one's a little easier to get on. They still won't go over my knuckle. So, and then to deglove after these are on, well, first you check to make sure there's no rip or tears or anything. They fit properly. These obviously don't fit me properly because they are 2 sizes too small. So after you check for rips and tears and make sure they're on right and all that, they go far enough up on your wrists. You take it off by grabbing the wrist. Make sure you're away from your patient. You're not going to splash them with any microorganisms or blood or contaminant. You pinch, pull it inside out, crumple, and take your 2 fingers. I've seen it done a couple ways. It's always the index and the middle finger. Pull around, inside out, and crumple. And then depending on if they're sterile or not, you toss them into the regulated medical waste bin or biohazard bin. And that is it.